So in the previous class, we have discussed about the introduction part, that is about the oral skin bathing. In that we discussed about the definition and we discussed about the purposes, we discussed about the key points and also the tub bath procedure, isn't it? In this class, the very important skill, very important steps of this procedure is bed bath. Okay? So this will be very important than the tub bath. Okay? Tub bath is not that much important, but bed bath is very important. So this will be in the separate skill playlist. Okay? It will be in the separate skill playlist. Okay? So BP, pulse rate and all that have been separated for the playlist as a skill lab. Okay? So you can study there for this one, and also it is very important for your exam also. 10 to 15 marks they may ask you in this. Okay? Are you understanding? Yes. So in the bed bath, so what we have to do, so here the patient who is not able to come out of the bed, for them we are giving the bath. Okay? So on the bed itself we are giving the bath, so that is called bed bath. Okay? Why we are giving? Because the patient unable to perform their own. Okay? For that we are giving the bed bath. Clear? Yes. Now getting into the definition, that so what is the bed bath? A complete bed bath is given when the patient is dependent. That means patient is not independent. Independently he can't able to do the cleaning. Okay? So that we need to cleanse him for which type of patient? One who can't able to provide himself as a perform himself as a cleansing of oral skin bathing. Okay? So for them we are giving what? Bed bath. Are you understanding? Everyone understood? Sir, what are the equipments we will see? That is, we can see the towels, we can see the some soap or else lotion we can say, isn't it? Solutions or lotions. Okay? We can use. Next, so basin will be there, warm water and soap will be there, towels, washcloths, bath blankets, clean linen for the bed and clean gowns will be there, body lotion will be there. Okay? Underpad, gauze pad and washcloths, urinals and bedpan. Okay? These are the urinals and bedpan. Okay? Bag for the soiled linen. Okay? So bag for the soiled linen, where after the bed bath you have to throw that in the bag, right? So you can use the black bag also, or else if it is any like bleeding, if it is there, that time you should throw that in the, you should dispose that in the yellow bag. Okay? Blood contained linen, that should be disposed in a yellow bag. If it is not there, then you should throw that in the black, right? Understood? Yes. So next one is toilet paper, water and ordered solution. Water according to the prescription we need to take that. Clear? Understood this one? These are the equipments. Now this bed bath procedures is very interesting, because you are going to do from the top of the hair up to your nails of the toe. Okay? So that it is very important and it's very interesting too. Okay? How you are giving the care, what motion you are doing. Are you circular motion are you doing, or else you are rubbing at the extreme level from the center? So that these are the things which you can easily see in these steps. Okay? So and it is very interesting too. Firstly, we will get into the first step, that is ask the patient preferences. Sir, why we need to ask the patient? What we need to ask the patient? We need to ask the patient, is this temperature is okay for you? Suppose 102 degree to 105 degree Fahrenheit you have done the temperature. It is their range between the water for the temperature is 102 to 105. In between that you have done 102. If the patient need more warm, then you have to do up to 105. Clear? So you are asking the preference of the water to be temperature, how much to be temperature. Okay? Are you understanding? So temperature you are asking, and you are asking for the privacy. That means you need assistance or you don't need assistance, you are asking that also. Okay. So here if the patient can able to perform, then you can leave some parts. Okay, that means private part. So they need their preference means, okay, let them do in the private parts. But overall the exposing chest is not relevant for the female patients, and exposing the private part is not relevant to the female patients, right, and also for the males also, right. So here privacy is very important, and are you giving the preference for the privacy or not? Okay. So if you are giving, then you are encouraging the patient participation. You are encouraging. Suppose if you say this much temperature, are you okay with it? So that time if the patient say yes, then he was encouraged to participate in the bed bathing, right. Okay. Yes. So special attention given to area specific, that's what I said. Okay. Yes. Second, in the second step what we have to do, so first we asked, before asking also you should wash your hands. There is a chances of you are going to touch the patient, so that, so even though in the steps if it is not there, that's your, it is mandatory to give the while you are explaining you can touch, right. So that's why it is mandatory to wash your hands. Clear. So before the procedure you should wash your hands. In between also it will comes and wash your hands, so that will be okay. As per your textbook they have given only in between the steps, that means after telling everything like pre-procedural points you are telling, and you are explaining the procedure, and you are taking the consent from them. So these are all the pre-procedural steps is there. No, in that they have not mentioned the hand hygiene, but it is better, it is best to have the hand hygiene before the telling about the pre-procedural preparation also you have to do the hand hygiene, right. So gather all the equipments. So why we have to gather all the equipments near the bedside? We are doing in the at the bedside, not in the bathroom, right. So we are doing at the bedside. And why we have to gather? Because we need to get access easily, okay, for giving care. Are you understanding? Are you understanding? Yes. And explain the procedure. These are all pre-procedural points. Explain the procedure for both conscious and unconscious. For the conscious also you need to explain, for the unconscious also you need to explain. For the unconscious, even though they are unconscious, they are unable to respond, but they are able to sense. Okay, that's why you need to explain. So to eliminate the confusion, we need to do this. Clear? Are you understanding? Yes. Next, fourth one. See the red one which is there, that one we are going to that is the indication, and why it is what is the rationale for that indication. So they have given in the blue. Okay, red is indication or a content you can say, and the blue one will be the rationale. Okay. Yes. Next one, prepare for the bathing. Now you have to prepare. So how we have to prepare for bathing? Now you have gather all the equipments. Now you have to close the door. You have to close the window. You have to close the door, and you should place a sign on the door. What sign you have to place? Bath in progress. You should tell that bath in progress, or else you should write occupied. So in the tub bath you saw that is occupied, right? Here they have mentioned bath in progress. Are you understanding? Next. So why we have to close the door and windows, and why we have to close? Because to adjust the room temperature. Okay. What is the normal room temperature we need to maintain? Not the water temperature. Water temperature is 102 to 105 degree Fahrenheit. Are you understanding? So in Celsius we can say that is 24 to 26 degrees Celsius for the room temperature we need to maintain before giving the bed bath. Okay, for that we are closing the window and door. Clear? Next. So in Fahrenheit we can say that is 75 to 79 degree Fahrenheit. This one is confusing. Okay, when it comes to the Fahrenheit, that you should be prepared to answer for 75 to 79 degree Fahrenheit. Many of the questions is like that, they may ask you 24 to 26 degree Celsius, but in chance, if in case they ask, okay, question in the Fahrenheit, that time you have to know this one, okay, that is 75 to 79 degree Fahrenheit. Okay, we are closing the door for the making to adjust the temperature also, and to decrease the chances of the draft. Draft means if the from the window or from the door, if you remain it open, so the cold air that makes the patient to get chills. Okay, so that in order to prevent the hypothermia, in order to prevent the certain standards of the temperature, we are closing the door. Are you understanding? Are you understanding? Yes. So draft means I given the definition there also. It means the preventing the cold air from blowing over the patient. I given the definition there also, right? Yes. So 4.1, that step I explained, the bath in the progress. On the doorstep, you should make it on the doorsteps, right? Next, before implementation, offer the bedpan and urinals in every procedure. In every procedure, in every OT procedure also, before doing any procedures like surgeries, laparotomy surgeries, whatever the surgery you take, before that you need to make sure urine output should be done, and bladder should be empty. Clear? This one is very important. Sir, why sir? Because sometimes, not in this procedure we are not giving any anesthesia, but in the OT procedure we are giving anesthesia. That time the smooth muscles may get relaxed, okay. That time the urinals may interrupt, and also it may infect the body part of the patient. So that's why we are not ready to make the infection of the patient. That's why we are draining all the urinals from the patient by providing the urinals or bedpan. So we are removing all the stools, fecal matter, and also urine. Are you understanding? From the bedpan. So that one we have to offer the patient to provide what? To provide the comfortableness when we are providing the bed bath, okay, and to decrease the chances of interruption. When you are giving the bed bath, they may ask you, sir, I am getting, or doctor or nursing officer, I am getting urgent for this fecus, or I am getting number 1 and 2. So they may ask, they may interrupt in the bed bath. So that we have to, before before doing bed bath, we have to offer urinals and bedpan. Clear? Everyone understood this one? Yes. So sixth one, see, in the middle they have given the hand wash, okay. So they have given hand wash. Now you have to do the hand wash and start the procedure, okay. Raise the head of the bed, or sorry, overall bed should, we have to make a rise our working level, we have to rise. Why we have to rise that in the working level? That means up to our waist we need to rise the bed of the patient, because we need to clean the patient. We can't able to bend every time, and we can't able to do the cleaning. So that will makes to ourselves to be back strain and to get injured also. And whatever the care you are providing, we can't able to focus there, okay. So in order to prevent that, so the word we can use to make it a working level, work height level, we will use ergonomic. What is the word? That is ergonomic. Ergonomic height, that means working level that should make the nursing officers to be comfortable manner. So that is working level will be called as ergonomic. Are you understanding? Yes. So why we have to give? To promote the body alignment, to balance the center of the gravity, okay. So this level we have to make at the waist level. And why we have to do this one? To promote the body alignment of ourselves and to provide focus on the work, okay, to have a focus on the work, right. And here if you are bending much, what happens? So we will get the back strain. Are you understanding? We will get the back strain. So this is about the 7th step. Are you understanding? Okay. 8th step. So use the bath blanket or a top sheet, so that should be dragged up to the foot and it should be folded. It should be folded up to the waist or up to the abdomen of the patient, and you should ask the patient to hold that fan folded top edge of the bed blanket. Okay. So, we need to tell the patient to hold that. So, I will show the images here. Okay. So, here you can see. So, we are telling the patient to hold that top edge of the blanket. Okay. When we are pulling the blanket from the bottom, so in order to cover the foot, that time it may drag or it may prevent the privacy. Okay. For that we are telling the patient to hold that fan folded blanket at the top edge. Clear? Are you understanding? Yes. This is about the eighth step. Okay. So, why we are providing the bath blanket over the patient? Because in order to provide the warmth and privacy. Okay. To provide the warmth and privacy, fan fold up to the waist and pull the blanket up to the foot of the patient. And before pulling the blanket, you need to ask the patient hold the top edge of the blanket. Okay. Hold the top edge of the blanket so that it can't ever it will not sweeps into the down. Okay. And it will not exposes the private area. Okay. If they hold. Clear? Do you understood this one? Everybody understood? Yes. So, in your textbook it has given very complicated. I have made very simple steps that you can understand easily, right? Yes. In the 9th step, remove the gown. So, you need to remove the gown. How we have to remove the gown? I will show you here image. From the image only you can understand, otherwise you won't understand. Okay. See here, can you see this nurse what she was doing? She was doing that. She was removing the, first she has already removed where there is a non-IV site. This one is, there is no IV site you think. So, in the where right side of the patient, this is the left side of the patient. Okay. So, left side of the patient is non-IV site and right side of the patient is IV site. So, first we need to remove the non-IV site. You need to remove the gown. Okay. Remove the gown, non-IV site. Clear? Later on, don't drag, okay, don't pull it forcefully in the IV side. You can drag it pulling, you can pull it forcefully in the non-IV side, but you should not pull it forcefully in the IV side. Okay. And how to remove that? So, you need to lift this one, lift this IV bottle, take off from the stand, and you have to that you need to through the sleeves of the gown you need to take it back from the outer aspect to the inner aspect of the gown. Are you understanding? So, suppose this is the gown, this is the gown you think. Are you understanding? Yes. So, yeah, this one is IV bottle and this one is what? What is this? So, this is the IV line and with the hand also here only, right. So, you should take from the outer aspect of the sleeve to the inner aspect of the gown, thereby you have to remove the gown freely. Okay. Are you understanding? So, first we need to remove the non-IV side and next we have to remove the IV side with carefully, and IV bottle we need to raise from the stand and taken from the outer aspect of the sleeve to the inside of the gown, so that it will prevent the injury of the injury of the IV side. Clear? Do you understand this one? Yes. So, which step it is? 9th step, right? Yeah. 9th step. What it is telling it? Yes. Remove from the non-IV side arm. Next, don't pull forcefully from the IV side. Clear? Okay. Lift the IV bottle and IV tube line from the IV stand. Clear? So, you lift it. Next, pass it through sleeve from the outer aspect to the inner aspect of the gown. Okay. Pass from the outer aspect of the sleeve to the inner aspect of the gown and take this one arm also inside, and the gown will be free of the patient, right. Yes. And free the patient from the gown. Why we have to do this one? Because to prevent the IV line injury. To prevent the IV line injury. Clear? Are you understanding? So one thing you can remember, one thing you can say, sir, we can stop the IV line, we can stop the IV line and we can do no. So you can do that one, but if it is very critical and if you stop that, that will be chances of the patient to get in complication, so that you don't want to remove it. So in that case you have to do this type of step. Clear? Okay. So next 10th step. So keep the side rails raise itself until the water is warm. Okay. So you are boiling the, not boiling, you are heating the water. So it should meet up to the 39 to 41 degree, or else you can say 102 to 105 degree Fahrenheit. Up to that you keep the side rails to be raised only. So patient, you are explaining the patient up to that. Okay. So let it warm and you are going to explain, just explain, don't lower the side rails before the attending the procedure or before giving the bed bath. Let the water will warm first and later on you can lower the side rails and do the procedure. Are you understanding? Still you have not given the bed bath. Still you have not given the bed bath. Still we are in 10th procedure, 10th step. Are you understanding? Are you understanding? Yes. So next, after when it get warm at a desired temperature, that is 39 to 41 degree Celsius. So what you have to do, you need to lower the side rails and give the bed bath. For the bed bath, how you have to give? So you need to place your dorsum of the hand on the, which one? On the mitten. We will call mitten. Okay. So you have to place on the mitten, and you need to bring opposite edges across over the palm. So you are placing what? You are placing the dorsum, and across the, this one is a mitten, below mitten is there. Okay. So you need to take across the opposite edges of the mitten to be over the palm. Clear? So I will show here, the image is there. Okay. So here, so you need to lower the side rails and you need to take the mitten and you need to place the dorsum on the mitten and you need to take opposite edges of the mitten over the palm. Clear? Understood everyone? Yes. So why we have to do this one? To provide the better control of the washcloth you are taking, and to not to get loose and to not to get a drag when you are doing the bed baths. Okay. So that's why you are making this much firm for the patient, right? That is 11th step. Next, coming to the 12th step. This is actually very important, from the head to toe how you are doing the bed bath, right? So place the towel on the chest, because to provide the privacy, everyone knows. Now dip the mitten. So you have encircled the mitten on the dominant hand. Now you have to dip that on the warm water, isn't it? And wash the face and neck. Wash the face and neck. How you have to wash? Suppose you are taken the mitten, it should be from the center of the forehead and outer aspect on both side. On both side you need to do. So outside from the middle, okay, from the middle of the forehead to either edges, either extreme level of the forehead you need to wash. Okay. Are you understanding? So do not use the soap, and unless if it is not prescribed, don't use it. Okay. Around don't use the soap around the eyes. Okay. Around the eyes you should not use, because to prevent from the irritation. And wash the forehead from center to each side. Okay. Center to each side. Clear? And for the below, that means below the this one cheek area, how you have to clean? Lateral aspect of the nose to the inner edge of the eye and towards the outer edge of the eye, like this. Clear? Like this. Are you understanding? And that should be done in a circular motion. It should be done like this. Are you understanding? Are you understanding? So you need to take and you should do like this. Are you understanding? Yes. Here opposite. So it should be from the midline, to the lateral aspect. Okay, are you understanding? Lateral, this one is a medial aspect of the nose, or else you can say lateral aspect of the medial means this mid one will happen. Lateral aspect of the nose to the inner edge of the eye and next to the outer edge of the eye. Clear? Are you understanding? And you need to do the circular motion on the face. Later on, rinse and pat it for the dry. Cheeks and ear and forehead. Ear also you need to clean. Clear? Yes. This is about the 12th and 13th steps. Next we will get into the 14th step. Now what we have to do in the 14th step? In the 14th step, listen here. In the 14th step, this is the distal end. What is this? This is the distal end and this is the proximal end. Now we have to wash, we have to clean, we have to cleanse the patient forearm from the distal to proximal. From the distal to proximal. Okay. Sir, why we have to do from the distal to proximal? To promote the circulation. Suppose the venous return has came here. Now we are doing from the proximal to distal. What happens? The venous return will be not that much effective than before. Okay. So all the blood will pools there in the distal part only. So in order to prevent that pooling, in order to prevent that decreased venous return, we have to promote the circulation. For that we are doing where? From the distal part to proximal part. Are you understanding? Why? To increase the venous return, or else you should say that is to promote the circulation. So if you do like this from the from the distal to the proximal, that time venous return will be effective and you are promoting the circulation. Are you understanding? Yes. So special care given on the axilla, as you all know, there is a sebum and sebum and sweat will be more. Okay. So that you are going to do the special care on the axilla. Wash the hand and fingers later. So first you have to wash from distal part of the up to the wrist. Okay, up to the wrist, from the wrist up to the axilla you need to wash. First axilla, later on after finishing from the distal to proximal and all axilla, you have to get into the hands. Palm, dorsum and fingers, everything you need to wash later. Okay, first wrist to shoulder, wrist to axilla and next hands. Clear? Are you understanding? Yes. So rinse and dry, move the towel in another side also. So in another side of the arm also you should do the same thing. So here you have done. So another aspect of the forearm and arm you should do the same thing. Okay. Yes. Next one, 15th. In the 15th we are providing the privacy here. We are providing the privacy. That means we are placing what? We are placing the this one towel. We are placing the towel and now we have to give the bath on the chest. Okay, on the chest how we have to give. So towel still on the chest, as we have given in the previously also we have given the towel on the chest to provide the privacy, right? So now also we are giving the privacy and we are washing under the towel. Okay, we are washing under the towel. Are you understanding? Okay. So wash the breast or a chest of the men in circular motion. Okay, and especially the skin folds of the breast or a skin fold of the chest, so that you have to wash it, special attention to there. Okay. Then next wash the lower abdomen. So lower abdomen is also covered with a towel, so you wash that one also. Clear? So first we washed which one? Face. Next we washed the arm, and later on we are washing the chest. The 15th step is washing the chest and abdomen. Clear? And lower abdomen also we are washing. Next, now 16th step, expose the far leg. So far leg you need to do the wash first, and next the near leg. Far leg means, you know, right? Far leg means that should be away from the nursing officer. Okay, if it is the leg is near to the nursing officer, that is near leg. Away from the nursing officer, that is far leg. So tell the patient to flex the leg, knee flex. Okay, you need to flex like this, and you need to place the towel with the making lengthening. Okay, lengthening of the towel. Remaining part you can place under the thighs or under the buttocks. Clear? And you need to place the wash basin here. You need to place the wash basin under the flexed area. Okay, and later on you need to wash. Okay, wash from where to where you need to wash. This is very important skill based steps. Why we are placing to when we are washing, that should be drained on the basin itself, right? Now, where to where we need to wash? From the distal part of the foreleg to the knee. Okay, this is always you should start from the distal to proximal. Why we have to do from distal to proximal? Again the same rationale, that is to promote the circulation, or else you should say that is to increase the venous return. So, venous return means that has to return to the heart? No. The blood should return to the heart? No, that is venous return. Are you understanding? So, if you are making from distal to proximal, then only the venous blood will goes to the heart. Are you understanding? Yes. So, wash from the foot to the knee, and next wash from the knee to hip. Clear? That means on the thigh part. So, knee to hip you need to wash. Why we have to do that? Because to allow the venous return, and later you need to wash the toe separately. Clear? And dry it all the area that you have been washed. Okay, that means only for the leg part. So, whenever you are washing, suppose you wash the face, immediately you need to dry it. Why we have to dry immediately? In order to prevent from the hypothermia, in order to prevent from the chills. Okay, are you understanding? Yes. Next, allow the bath water to change the bath water. Suppose all the from there to up to the leg you have done. Now the perineal care you should do. Perineal care doesn't need that means whatever you wash it, no, that will be not clean now, because from the head to toe you have cleaned every part. Now this one is not clean. Okay, so that's why we need to change the water for the perineal care. Perineal care, they may ask you the different type of question. So write the menstrual hygiene. Okay, they may ask you write the menstrual hygiene, or else they may ask you write the female perineal care. Are you understanding? This type of questions they may ask you. So first we will finish this, later on we will get into the next. Okay, so change the bath water and turn the patient on side lying position, and you need to wash the upper and lower torso. Upper torso means this is back portion will be called as upper torso, and lower portion will be called as lower or back, you can say lower back or lower torso you can say. Clear? Understood everyone? Yes. And change the bath water for the perineal care. First you give the care for the back also and dry it, and later on you need to change. In this change bath water, that should be come here in the 19th step. 17th step is not there, you just think 19th step. Clear? Are you understanding? Yes. Now, yes, next 19th step. Here in the 19th step, what it is saying, that is patient sideline we have said. 19th that is change the bath water. Now females, for the females how we have to clean. So ultra important thing is how we are going to clean the vaginal or the overall vestibule area. Overall the vestibule area, or else you can think that for the males that is penile area. How we are going to wash, that is very important, because you are cleaning in such a area where there is highest risk of infection. Okay, for that you have to clean appropriately from where to where and how to do, that one you should remember. Clear? So very importantly you need to wash it from front to back. You can say anterior to the posterior, or else you can say from the urethral meatus to the vagina, From the urethral meatus to vagina you need to wash. Are you understanding? Clean from the urethral meatus. One stroke you have done, dispose that and take another one. Okay, when you are doing that, because if you have done from one stroke, that is from the urethral meatus to vagina, now it will be called as contaminated, right? So again, if you are using from the front to back for that one only, then it will be infected for 100% sure, right? So you need to dispose that and take another gauze piece, and another gauze piece from the front to back you need to clean. Clear? Okay. So why we can't able to do from the back to front, sir? Because back side, suppose anal side, that means in the rectal side, it is very much infected already. The n number of gram negative bacteria will be there in the stool or fecal matter where it will goes from the orifice. Okay, so that one is very contaminated area. Always you need to remember, we have to clean from the least contaminated to the most contaminated area. We need to clean from least contaminated to most contaminated. So where is the most contaminated? That is from the anal. Anal is most contaminated. Are you understanding? So we need to clean from there. Clear? Yes. Next, for the uncircumcised males. For the uncircumcised males, you need to pull the penile head of the penis. Okay, you need to pull that glans penis, and you need to clean from the center to the circular motion outer section. Up to the outer section you need to clean. Clear? You need to retract the glans penis, and later on from the head of the penis, that is from the urethral meatus point to outer aspect. Clear? Circular motion for the males, front to back for the females. This point is very important. Clear? And for the catheterized male, what we have to do, sir? Just for the around of the insertion we need to clean. Clear? And that too also circular motion from the inner to outer aspect. Clear? Understood? Yes. And when you are doing this one, I will tell you. For the males, I will tell here itself, because the male perineal care I have not done. So in the uncircumcised males, you need to lift the penis in 90 degree, and later on you need to retract. Okay? Clear? Are you understanding? And for the males, very important, position is supine. For the males, it is position is supine. For the females, it is very importantly dorsal recumbent. Sir, what is the difference between the supine and dorsal recumbent? Means nothing. Supine is only you are lying on the back without flexing of the knees, right? But in the dorsal recumbent, lying on the back and flexing the knees, this is called dorsal recumbent. For the females, flexing of the knee is very important, okay, to access the perineal area. For the males, we have to lift the penis 90 degree, so that there is no need of lifting, there is no need of flexing the knee. Are you understanding? Yes. So next we will get into the female perineal care. So this is also the steps in the bed bath, that is not excluding out. Okay. So now, until now we have completed the 19th step. Still the 11 steps is there. The 11 steps, in that some of them are perineal care and some of them are documentation and completing care, like post procedural thing. So I will tell you one by one. So we will continue from the female perineal care. What position we need to give for the females? Dorsal recumbent position, that is flexing of the knee with the lying back on. Okay. Remove the peripad or dressing, whatever the peripad, if it is there, that we need to remove. And observe for the drainage. If you observe any drainage, if it is there, don't remove that from the bare hands. You need to wear the clean gloves, okay, and later on you need to remove that. Clear? Yes. Discard the soiled item in the yellow bin, okay, yellow bag, according to the BMWM, that is biomedical waste management. Later do the clean. and slip the under pad if the drainage is more. That place you need to place the bedpan. Suppose you have taken the under pad from the perineal care, now perineal region still bleeding is happening, that is due to the surgery, or that is due to the menstrual bleeding, or that is due to the postpartum hemorrhage after the delivery, that is happening, right, bleeding is happening there. So that time you need to place the bedpan, okay, right, yes, bedpan under the hips. So in the 4th year you will understand what are the discharge will comes from the perineal region once if it is after the in the postpartum time. In the postpartum time, lochia, the release will occur, that is yellowish discoloration, red discoloration, white discharge, this one will happen. So we can call lochia, alba, rubra, like that we will call, okay. So that one you will study in the which one, 4th year, clear. 4th year now the same wise it is came that you can if it is the syllabus, if it promotes, that time you may read, you may get this study in the third year itself, that means in the 6th sem, clear, yes. Next, slip the under pad we have done. Why we have to slip the under pad and if the drainage is more? Because we have to prevent the strain, and we need to what we have to place, we need to place the pillow under the head. Now if you are giving the bedpan under the buttocks, right, now if they are making that type of Kegel exercise, they are lifting their buttocks upward, then they are giving the strain to their what, neck. So in order to prevent that, in order to prevent the strain on the head, so you are placing the pillow, clear. Under the shoulder you have to place, okay, are you understanding, under the head and under the pillow. So head, and you have to write, that is very importantly, that is shoulder. Shoulder also you need to provide. Why? In order to prevent the pressure on the shoulder, especially the scapular region, scapula or as acromion process region. Are you understanding? Yes. Next, rinse with the prescribed solution as per. Before that you need to rinse that with a normal saline. Later on you need to rinse with the prescribed solution. If the normal saline is contraindicated, then don't rinse the normal saline, rinse directly, that is prescribed solution, clear. Warm water, that is 102 to 105 degree Fahrenheit, we are still giving the bed bath. Are you understanding? Yes. So clean the area from pubic area to the rectum, as I said, from the front to back you need to clean. This is the overall menstrual hygiene. Please understand, the question may be different. They may ask you state about the menstrual hygiene, they may ask you state about the menstrual hygiene, or else they may ask you write the fully steps for the perineal care for the females. They may ask you this type of questions, right? Yes. So completing the care and all we will do in the next class, clear. So up to this we have completed. Now this one is a post procedural, that one we will do in the next part 6 we will see. This one is part 5, okay, this is a part 5. So thank you for listening the class. In the next class we will discuss further.